Good evening, everyone. I'm glad you could join us for our monthly podcast. We're missing our co-host, Marcus Murray. He's having technical difficulties. What happens when your internet's in the hood? But let me welcome our two guests, and I'm going to ask them. We'll start with Dr. Robertson. I'm going to ask her to unmute herself and sort of do a brief introduction.
All right. Thank you so much for allowing me to be a part of this conversation. I am Dr. Tanya Robertson, and I'm a community psychologist. And my role as a community psychologist is to meet people where they are, to help them cope with any barriers or any issues they're having in the community where they spend most of their time. And I'm also the director of community engagement, program development, and academic support at Governor State University in the College of Health and Human Services.
I'm on mute. I'm sorry. I said I was thanking you for being here and looking forward to our conversations. And Dr. Rubin, if you could introduce yourself.
Yeah, thank you also for having me today. I'm looking forward to it. I'm Dr. Rachel Rubin, and I'm a senior medical officer and one of the co-leads of the Cook County Department of Public Health, which is the public health department that covers almost all of suburban Cook County. And you know, we've been in the fight on the ground since January 23rd of 2020 with COVID and trying to get testing and vaccination and education out to our most vulnerable parts of our community, especially, and to try to do the best we can to stomp out this pandemic.
So, you know, there's so much going on with COVID, and it's very confusing. I must say, as a public health professional myself, even I have trouble keeping up with all the different news releases. So we've just seen a situation here in Chicago, which I completely agree with having a mask mandated again. And of course, we had from the White House today this announcement, which is more confusing, about possible boosters, though I want to emphasize that information did not come from the FDA or the CDC or any of the medical authorities at this point. So let me start by asking both of you, what has been your experience, ignoring these recent things, what has been your experience even before Delta with what was going on with the pandemic, and how especially the Black and Latinx communities were responding to this challenge? Tanya, what have you observed in your work?
Okay. In my work, working as a community psychologist and studying the impact of disease and its inconsistencies, I have always seen a pattern in health and healthcare inequities that exist between in the minority communities that is very substantial. And with the overlay of the coronavirus and the magnitude of its spread and deaths, I see that it has occurred. It has only magnified what was already going on. Black communities, Latinx communities structurally are now the hub for the virus. And in my work, I try to strongly advocate for education. I don't want to just keep bringing up there's a virus, and then it's a vaccine, which everyone thinks came so quick, and now we want you to take it. And then they're like, I'm telling people, you need to take it. And they're like, who says we need to take it? Because it's a lot of medical mistrust. And even in the communication, it has gone from in the very beginning that only older adults could get it. And even with my 26-year-old daughter, I'm here in the community. I'm a community psychologist. I'm advocating for to follow the recommended safety guidelines. And she just was vaccinated fully last month. So they've gone from no mask to 1 mask to 2 masks. Get tested, don't get tested. From 1 vaccine to 3 vaccines. And it's causing a lot of issues in the community. And right now I'm working actually trying to get more people vaccinated. But I feel that the people that have planned to get vaccinated, they've done it already. And then the other people are kind of like straddling the fence. And I know it's one trending term they're using that they're calling it vaccination hesitancy. But I feel it goes a little further than that, because you have people that are hesitant, and then you have people that are reluctant, like I mentioned, that straddling the fence, and some that just are defiant because they don't want to do what the government tells them to do, or they don't know who Dr. Fauci is, or anyone, so they just don't want to listen. So they'll rather just die before they take the vaccine.
I can hear a little frustration in your voice there, Tanya. So let me ask Dr. Rubin. You know, I must say that the Cook County Department of Public Health, which in all due diligence, I need to let people know that is an organization that I retired from, but it's a department because it covers suburban Cook County. It doesn't usually get as much play in the papers, etc., as our city Department of Health. But actually, the populations between Chicago and suburban Cook are about equal. So really, and really, the challenge that Dr. Rubin's department has been facing has been tremendous. I'd be interested in your notions, especially in what parts of suburban Cook you've seen good uptake of the vaccine and what parts are more challenging.
Yeah, you know, we make up about 130-ish municipalities throughout all of suburban Cook in our jurisdiction, and that's about 2.5 million people, about 700 square miles that we have to cover. But within that, we've been from the very beginning trying to keep very close track of what case rates are, and then ultimately the vaccination rates once we had vaccine within all of the municipalities across our jurisdiction. And we found that, not surprisingly, that the areas of the county that have the lowest vaccination rates and also the highest infection rates, especially early on, there's not quite as much of a match now, but especially early on, are in our Black and Brown communities, and also in sort of certain subpopulations that are the most underserved, you know, throughout all of suburban Cook. And unfortunately, that's not surprising because of all of the reasons that Dr. Roberson has talked about. And we've been trying to put disproportionate, appropriately so, resources and outreach to those communities. And we engaged a whole group of community-based organizations that work in and are from those communities. So within the Latinx communities, which are mainly in the western areas, but there are also pockets in the very northwest suburbs as well. And African-American communities, which are also in the west suburbs and especially in the Southland. And we've had a real struggle in bringing up those numbers of vaccine, especially. Right now we have, for the last couple of months, even though this was a program that was in place since the vaccine started, but especially focusing on what we're calling our hyper-local approach over the last couple of months, which means working very diligently and not getting discouraged when we do a vaccination event, usually working with a community partner that does vaccination in those communities, or sometimes it's with our own staff or Cook County Health, the clinical system staff, to in these communities, and not to get discouraged when we only get 10 or 20 or 30 people, because it really has to be almost sort of a door-to-door, block-to-block kind of engagement with people. And we've started to do some door knocking where we pair up people that work for the health department with people that are from and work in the communities, that are from those places. So with the community-based organizations that know the suburbs that we're in, and to go door to door and say, we're having an event tomorrow or 2 days from now in your community, please come out, and to answer whatever questions people may have. And I find it's a win if we get one person that didn't want to, and that we get them beyond sort of their doubts and to come in, because we know that if they get vaccinated, they're going to come back home and talk to their friends and family and hopefully get a few more in to be vaccinated. So it's really become a very local, almost individual kind of engagement to get people out to be vaccinated, because we understand people have questions that are quite legitimate. And also there are a lot of myths out there that we want to try to address.
Welcome, Mr. Murray. I'm glad you were able to join us tonight.
Yeah, I was having issues, man. It's like they don't want me on the show talking today or something, man. Like, for real. Like, I've been listening. What's up, Dr. Roberson, Dr. Rubin? How y'all doing?
Good. How you doing today?
And so we missed you, and so we didn't have a chance to talk about the Bears exhibition game or other critical things.
Justin Fields, the Sox, the Cubs. We're doing good. Let's just rock in it, because I've been getting a lot of calls and texts about this show. People are worried and they have questions and they're concerned. Like, so I just want to start it off by just throwing out some of the questions. Why should Black Americans, well, let's just speak for the people I know. Why should Black Chicagoans trust the government, trust the vaccine? Because now they're coming out with this Delta, saying that people who are vaccinated might need booster shots. So what's going on? Is this just a money grab from the pharmaceutical companies?
Well, I first, let me just say, I would never be someone to say to people, trust the government. I don't think that's the right question or the way to think about it. I think the key thing is that we ought to be the government. We don't have enough control as we should. So the real question is what's going on, what you've asked before. And fortunately, we don't have to just look at the United States government. We can look around the world and have some confidence that things are going on that makes sense. What I will say is this, to me, in my mind, I'd be interested in what other people think. I think the biggest challenge we face with COVID is not just the lack of trustworthiness of the medical care system, which is certainly true, or the perfect reasonable fear that people have about what government is doing, especially in terms of people of color and healthcare. I think the real problem we have is this is a new virus. No one knows the answer. This is not like measles or smallpox or other things that we've had for hundreds of years. And so there are many things that we don't know. And so what we're seeing as lay people is we're watching scientists and researchers discover new information all of the time. And when we communicate that discovery, then people get upset, because usually you go to the doctor says you have high blood pressure, I'm going to try this pill. But really, today, when you go to the doctor, they're saying, oh, we have this new virus, and oh, look, here's a Delta variant. And so the uncertainty that we are seeing is part of what you expect when you're dealing with a brand new problem. And so that means that people have to be able to think critically. They have to be able to be in touch with people that they trust, and they have to be comfortable with a certain level of uncertainty. I don't know. What do you think, Tanya and Rachel, about that kind of notion?
I really feel at this point that, and it's maybe easier said than done, let's just forget about the government. Let's forget about Trump, the China virus and all of that. Wherever it came from, whoever bought it here is here now. So this is the here and now. And you're seeing people around you dying all the time. And like I call it, we are not all in this together, because the minority groups were already so far behind the starting point before this even started. So now that this here, then what are you going to do about it? So it's a lot of problems, but what are the solutions? And there's nothing that's 100% guaranteed. So with this vaccines is what you use when you have a viral infection. And so that's what they have now. And instead of just like now, they say it's a law to wear seatbelts. But people have died wearing the seatbelts, even in accidents. But I'm never going to get in my car and not put on my seatbelt. So right now, let's just deal with what's at hand. And even if you're not going to get vaccinated or I would recommend you to follow the recommended safety guidelines and to get tested. Although I look at testing like abortions, when they say abortions are not birth control. So I know the testing does actually show you the cases, they detect the cases, but I think that if you go ahead and get vaccinated, but then you still have to get tested then too, don't you? So it's like 6 in one hand and a half a dozen in the other, but whatever, so you can remain safe so that you won't get it.
Let me throw this out real quick. I got vaccinated against my better judgment. I really don't know why I did it, but I did it. And even saying it, even when I say it like that, it feels uncomfortable. You know what I'm saying? So I want to throw this scenario out with people. With school starting back and kids going to daycare, how are we supposed to protect ourselves, even as vaccinated people, with our children going back into places where this virus can spread? What do we do then? Like, even if we're not vaccinated or vaccinated, now the world is coming back, so our children are leaving. How can we protect ourselves? And then what new variant might come out? Because there's a list going around on social media that came out a month ago that named all the potential variants, and it seems like they're all falling in line. So how can we protect ourselves in our home now with this new variant?
Yeah, there's been a lot of debate, right, about letting our kids go back to school. And we know the negative aspects of not having our kids in school. There are a lot of kids that can't really engage in learning really well, looking at a screen all day long, or they don't even have the screens. They don't have a good Wi-Fi connection. It's very hard that their signal is always dropping out, or they have to share it with another sibling, or they have to be taking care of their siblings because their parents have to go out and work, and so how can they study at home? There's all kinds of barriers. And so we know the kids do better, most children do better when they're engaging with their peers and with their teachers in person. So we do know that there are safe ways of doing this now, and it's taken a long time, or relatively, a year, to figure this out. And we can look to Europe and to see the things that they have tried ahead of us. And we do know that first and foremost that masks work. And it doesn't mean that you wear it sometimes and not other times, or that some people wear a mask and then others don't. And the first rule for schools was going to be, if you're vaccinated, you don't have to wear a mask. But we know that, especially with the Delta variant, that it doesn't necessarily prevent you from getting the virus. Though in most cases it does, between 80 and 90% protection in most cases. But if you do get it, you can be totally asymptomatic. And that's typical for children to not have many symptoms. And so they can come into the school not being vaccinated and not wearing a mask, or even being vaccinated. You're a 12-year-old, you're a 13-year-old, and you have no symptoms. And so you're going to be spreading it out to the younger children at school. And then they're going to be bringing that home to their grandparents whose immunity has waned or whatever. So we know that masks work. We know that masks combined with the physical distancing works. 6 feet is what I prefer. The schools are saying 3 to 6 feet, and 3 feet is better than nothing. But you have to do all of these things combined. And then you also have to do it with appropriate air handling in the rooms. So good ventilation. There's this phrase that we use in occupational medicine that Linda and I know. It's called the hierarchy of controls, right? The last thing you want to do is have to slap a mask on somebody. That's like personal protection. However, you need to do these things in combination. So you do things that are like administrative controls, which means making sure you don't have all the kids in the lunchroom at the same time. That as much as you can have them outside, do that while the weather cooperates. That that you don't have everybody crammed in the hallway at the same time, that you have to stagger things. That's like an administrative control. And then you have to do an environmental control, which is things like making sure that there's good air ventilation. Open the windows if you can. Make sure that there's good filters and circulation in the room with the HVAC system. And then the personal protection, which means wearing the masks. And these are all things that if you do in combination will make these schools pretty darn safe.
What
One
about
thing,
hold on, Doc. What about,
Yeah.
you can answer this too. What about daycare centers where children, are usually like 2 to 5 running around, wiping their nose, touching things?
right?
How can we ensure extra safety and extra precautions? Because these are some of the questions people are asking. And even with the air ventilation, do you all have any suggestions? Is it getting an air purifier?
There's certain specific kinds of air purifiers that we can come back to and people can look up. But let me just say, so childcare, so we were talking about K through 12, childcare, daycare centers are a special risk. And let me just say this, let me go back a little bit and come back to your question. In the original COVID-19, the percentage, the number of children who got really, really sick and were hospitalized and died was relatively small compared to adults, and certainly compared to those of us that are older. But one thing we knew, we couldn't predict what month or what week or exactly how it would look. When you don't have a strategy, a worldwide strategy to have vaccination in the most critical areas in an even way, what happens then is people pass the virus from one person to another. The more that happens, the more the virus changes, mutates. And so the variants we're talking about are completely predictable. It doesn't mean that they always get worse. Sometimes they get less dangerous. But we know when you have the virus circulating in a population, just like what happens with seasonal flu, it's going to change and mutate. So the fact that we were going to have variants is well known, and we'll continue to have them because we still don't have a vaccination program that addresses the entire world. The poor countries are being left out of this process, and that's going to be dangerous for us. Even if we vaccinated 100% of people that live in this country, we would still be in danger because we're not vaccinating the rest of the world. So I want to say that this is a question of thinking about the risk that's involved. None of these vaccines, just like no medicine, is 100%. So I don't care what kind of vaccine you get, it's not 100%. These vaccines for COVID are actually extraordinarily effective. They're much more effective than our typical vaccines that we use. And so people have to weigh what they're doing. Do you really want to be in a position of not being vaccinated, going to work, and running a higher risk of infecting your family and friends? One of the scary things about the Delta virus is that now we know that not only can vaccinated people get infected, fortunately, the vaccine protects them from getting really, really, really sick and being hospitalized and put on ventilators. So that's really, so it's good that you got a vaccine, Mr. Murray, because if you get infected with COVID, the chances of you ending up in the hospital are even smaller. So I know it's scary. So, and let me just say this.
I'm not getting a booster though. I'm not about to do that the rest of my life, man.
So I have two things to say about that. First, this is scary. So the people that are scared, that's perfectly reasonable because we have a worldwide infection. We've had these before, the Black Plague, smallpox, the 1918 virus, flu virus. So it is scary to be bombarded with this world. Think about this went around the entire world in lightning speed. So I perfectly understand that people are frightened, but we still have things that we can use. It's not like we're defenseless. The masking, the social distancing, washing your hands. But the most important tool we have at this point is vaccines. And we know as things change that we might have had to get boosters, and we might even have to change the vaccine in the future. So this is to be expected. And I think what we have to do, and I'll be honest, for Black people especially, we're used to being attacked and we're used to defending ourselves. No matter what happens. And so I think here we have to remember that we can defend ourselves. We're in a better position than we often are. And we have tools available to us that can help us deal with this coronavirus. So I am saddened, and I think Dr. Robinson mentioned, people in healthcare are getting more and more frustrated because they see people not being vaccinated, and then they see people unnecessarily dying. Last year, before we had a vaccine, you would be upset, but there was nothing you could do when people got sick and died. But today, there are things that we can do so that almost no one has to die. It's a tiny, tiny fraction that would die. But and so that's what's really frustrating to me as a doctor, to see people die of any age, but especially young people and children die simply because we haven't been able to vaccinate them.
Dr. Roberson, what are some of the things that you're hearing with people that you're talking to about their reluctancy around a vaccination or a booster shot?
The one thing that it came too fast, they're talking about that a lot. And a lot of people are listening to their family members who they're not the experts in it, but they're going through, they're believing what they say. They say that the government is trying to kill all Black people. It's a conspiracy suggesting that vaccines are tools to implant microchips into people across the globe so that they can spy on them. Then it's a lot of barriers, like it's a lot of medical mistrust, and the fact that people don't have the health education or literacy to understand the whole medical or research process. They have no confidence because of this, so they really don't know what to do, so they are err on not doing anything. And then, like with the government, last year when it started, the fact that who was our president caused a lot of this. And in the African American community, religion is a huge barrier. They say a lot, I'm going to pray over it. It's God is going to protect me and my family. God is my vaccine. But then I tell them faith without work is dead. And then I cannot do anything. I mean, the Tuskegee syphilis experiment is a big issue, because even if I'm in the community, let alone trying to give the vaccine, just trying to give health education, they always bring it up. And people say only the older people know about it. But in our culture, like my parents are from Mississippi, so they tell me a lot of stories. So it's a lot of storytelling. So the young people know about it as well. And it was an unethical experiment. That was a inhumane study that was only supposed to last 6 months, and it lasted 40 years. But no vaccine was even given there. It was aimed at observing the natural progression of syphilis, leaving it untreated in these African-American men in Alabama. So it's a lot of confusion with that too. I even heard one of the newscasters on Channel 7, she was referring to the Tuskegee syphilis study, but she called it the Tuskegee Airmen.
Makes no sense. So Doc Murray and Doc Rubin, I know you, and thanks, Tom. I know you all know this already. So basically, what Dr. Roberson described is the word on the street what people are going through from the government level, and this is not a reflection of individuals, but the system as a whole, starting with Illinois' governor on down. We haven't really seen any culturally specific things dealing with the virus in terms of education awareness, or written on a literacy level that a sixth grader can understand for the Black community. What we've been seeing and what we've been hearing are universal messages. These universal messages are sometimes created by white organizations or non-Black organizations, and it's not really having an impact. It's not touching the street. It's not hitting the people. It's not going to that personalized approach that Dr. Rubin was talking about. So how can people like Dr. Roberson, other community-based organizations, and I mean the real ones, I'm not talking about the ones that just, get a man some campaign money and get the money. How can they participate in sharing the message for our people? Because if people like Dr. Roberson, Project Brotherhood, and other individuals really aren't involved, what are we supposed to do? Because the hood trusts us because we trust the hood and we love them. They don't trust some of y'all, man. Doc Rubin, Murray, you all are government.
As you know, the city of Chicago tried to have a committee to work on equity in a COVID response. And I'm going to say this, and I don't mean to be insulting to anyone, but as you perhaps mentioned, whenever there's a few pennies around, we often see community-based organizations scuffling for those little pennies. Let me just say that I think more money should be put into community organizations to help to pay them to do this work. But also, part of the problem here is that we don't have enough people that look like us in these structures, in the health departments, etc. You know, I'd love to see people like Amina with a social media presence and understanding, you know, that can actually talk to that age group. That means you have to have some faith in putting resources with people that can make an impact. And you have to, and I will say this from working with unions in health and safety, you have to not be so concerned about are all the technical details right, because people have different reasons for getting a vaccine or not getting a vaccine. So I was talking to one young person in their early 20s recently. I couldn't convince them of anything, but one thing that did convince them that they were going to go get a vaccine is the notion that pretty soon you wouldn't be able to go to a local club or anything without proof of vaccination, or people that are going back to school, going back to college level courses and stuff, and have heard this. So I actually support trying to have mandates where it's reasonable. I think, for example, people working in healthcare should be mandated. Nursing homes, I don't think you have a right when you come to work to actually make your patient or your client sick. But I think it means that we have to put more resources in building, not a grant that's going to run out in 2 years. You know, so the grant for the contract tracers, which we've all know about to help work on, I think it runs out technically next June or something, right? Right, Rachel, I think it runs out too soon.
It runs out too soon. Let's say
right.
that.
We need to be building the public health infrastructure. If you had people that are living in our communities that had jobs in various community organizations, as well as public health agencies, state-run public health agency, governmental public health, that were working in the community all of the time, there would be a level of trust built up. So the next time, because there will be a next time, the next time there's a pandemic with a novel virus, there'll be some trust to build on.
So that's one of the things too. I think, and I'm gonna speak from personal experience. As far as our Illinois government, I don't feel as though there's anybody that speaking on behalf of Black folks. Like when Dr. Roberson and other organizations do pop up PPP and pass out stuff, and when they do a lot of community engagement, whether it's barbers, whether it's beauticians, whether it's the key stakeholders that are in buildings. These are the key influencers. These are the people that make the decisions. These are the people that the hood trusts. So there has to be a way that we not just incorporate their thoughts, but also pay them for their time and their effort. And I think that's what's forgetting. And I know you both, and I'm hoping other people listen, that we need those advocates in the room to explain that, to explain Ms. Johnson that had the home daycare for 20, 30 years and raised half the block. She needs to be involved in this fight for Blackness. And it's not about, to me, mandating whether or not we do it. It's about providing people with the right information. And if we give them the right information in a loving way, they'll be able to make the right decision, whatever that is for them. Some people have chosen, and this is my question, I know I talked a little long. Some people have chosen this route as opposed to the vaccine. What they've chosen is to take the cocktail that's given out with the zinc, vitamin D, and vitamin C. From a medical standpoint, how is that when it's compared to the actual vaccination? Is that equivalent? Is that something they should do or not do?
Marcus, the way I address this actually with my patients when they come in and they say that they want to use these herbal remedies or these cocktails, so to speak, I look at the ingredients and I see whether it's going to interact with any of their medications or treatments they want, if they would interact with a vaccine. And if it doesn't, I would say, sure, go for it. It might boost your immunity a little bit, but it's not going to prevent the virus. It might help you fight it off a little bit better, but even that is unclear. We do know that there are some positive effects from things like zinc and vitamin C, but it's very modest. And I just want to say, a vaccine is meant to prevent a disease. It's not meant to treat it. It's meant to prevent the disease or to at least eliminate you from having a severe case of it that might require you to be hospitalized or even die from it. And COVID is here, and it's deadly, or it can be deadly, right? And I think that we need to really focus on what's real prevention. And it's interesting, developed countries like the United States, we don't care about prevention. We care about treatment and shoring up the pharmaceuticals and getting expensive medications out there into people. We're not focusing on prevention. And, when I worked in Southern Africa for a couple of years, where they had the most well-developed preventive structure that would far surpass the United States. And it was in Mozambique. It was at that time one of the poorest countries in the world. But they did vaccination campaigns out in these distant rural areas. I mean, we would go there on the back of, we would go on these pickup trucks or whatever and go out there. We'd be covered with dust on these back roads, and all the school children would be lined up to get vaccinated. And it's not because they were told to do it. Of course, their parents told them to do it, but it's not because they were being forced to do it. It's because they said, yeah, this is what's going to prevent me getting measles. I have seen family members die from measles. We don't see that in the United States very much. It's sort of like we put blinders on and we just think, there's a pill you can take and we're going to cure you from it. But preventive services and really trying to prevent the virus from spreading is what's really important. And that's what the vaccine does. And so if somebody wants to come and take a cocktail, I say, sure, go for it, but also take the vaccine.
Another thing, I think this is important in terms of history, because what Dr. Rubin's saying is so true. We have used vaccines in this country long enough that many of these problems we don't see. But when I was a little girl, for example, I saw people getting polio, okay? And we had, you would see on the evening news the iron lung. I'm not sure that people today even remember what an iron lung is. People would have polio and they would basically be living in these huge machines because otherwise they couldn't breathe. And so polio was a real fear among parents when I was little. And it spread a lot in the summertime. And I remember standing in line to get one of the early oral polio vaccines, and how my community, and I lived in the projects in Cleveland, and then they were thrilled that this new vaccine was available for people. So I think one of the challenges we have here in this country is, unless you're very old, you haven't seen people die from measles or chickenpox or these other quote unquote childhood diseases. So you have to weigh what happens if you have 1,000 people get measles versus what happens when you vaccinate 1,000 people. And so that's the balance that we're not seeing. We already know a lot about COVID. We know there's long COVID, these long-term sequelae. We don't know how long they're going to last. And I just think it's a very dangerous thing. And I think that I hope people spend time and read about it and study and think about the odds. It's not just a question of the cocktail. To answer your question, the cocktail's not going to protect you from COVID. Maybe it'll protect you from a cold, but even that's not sure.
I think Dr. Rubin made a good point when she said vaccinations are not cures, they're for prevention. I think even language like that helps. You know what I'm saying? It helps all cultures. And I go as far to say probably in South Africa, one of the reasons it helped is because you probably have people that look like them leading the cause with assistance from other races. So when we take that FUBU approach in our community, for us bias, I think we'll have an impact. So like Dr. Roberson, what are some of the techniques and ways that you talk to people that look like you in terms of vaccinations and preventive measures around COVID and the Delta?
Okay. Well, I wanted to add something to the conversation you all were just speaking about prevention, because this is not the first pandemic and it won't be the last pandemic. So everything that I do is I just put on my Facebook page. It's a statement that says everybody's been eating chicken nuggets and hot dogs, and now they want to say they don't want to take the vaccine because they don't know what's in it. But I feel like that education piece is a big part of it. I mean, educate, educate, educate. And then, like you said, it needs to be culturally tailored and make it relevant for each group. Don't have it work for one group and then translate it into Spanish and then put a kente cloth on it and put it in the Black community. It has to be high because it's highly individualized. So everybody has different needs. And yeah, it takes a little bit more work, but then it's worth it because I'm actually one of my strong community partners. We're working with the Healthy. They got the grant for the Healthy Chicago Equity Zone. And so what we've been doing is making tailored messages, but we also are doing a small, like just COVID vaccination interest. So we're asking them, have they taken it? We're asking a little bit about their family history to just see how important do you think this is to you? So if you know that your family has any of the underlying health conditions that increases your risk for COVID, like diabetes, heart disease, cancer, dementia, diabetes, would this make you want to take the vaccine more? So we're focusing a lot on the people that haven't taken the vaccine, trying to find out why, and then trying to address those issues. And like Dr. Rubin said, I don't feel like we have 13 organizations that's working with us. So they're real ready to go out and have a big health fair. But the target that we're working on now, I think we need that warm handoff with them. I don't think it'll be anybody that we probably get 1 or 2 to 10 at a health fair, like Dr. Rubin said, and that's very good too. But going to the house or meeting them at a church or somewhere a little bit more intimate so you can address their concerns, I think is a very good strategy. And that's what we're doing. We have an inspirational poet who's doing some poetry for us. I'm having my daughter do a video on why it took you almost a year to get vaccinated, and your mother is out there in the community talking about this all the time. So we're doing some things like that.
You know, one group that has been very successful at getting vaccinated, and I think it speaks to what you're saying, Marcus, is a number of our Native American tribes. Now, nobody should be less trustful of the American government than our Native American brothers and sisters. But what they have done, because they have control, they don't have a lot, but they have control of their health system, no matter how underfunded it is. They just took control of that. In fact, the government was slower than as they usually are getting the vaccine to them. They said, no, we are vaccinating our community, and they've actually gotten very high rates. There was someone on the news this morning I was looking at in Mississippi, a small town, 1,000 people. I forgot the sister's name. She's an older sister. She runs basically the local grocery store there, you know, the local sort of drugstore. So everybody in this town knows her. She just decided on her own. She didn't have no grant. She don't have no health training. She just said, I'm going to get my town vaccinated. And they're up to 9 of the people who are eligible to be vaccinated. They're at 94%. Because she's just been going door by door, step. I know you, I know your mama, I know your grandmama. You need to get that, and really having that individual touch.
And those are the people that we need to support. Those are the people that are looking for the press. There's a lot of programs out there like helping communities help themselves, what the fatherhood, that actually care, not looking necessarily for any fame or fortune, but they need to be compensated and they need to be respected more so than that. We need to ask that lady, what is she doing? We know there's trust and love there, but we need these scientific, academic, government cats need to ask her, how are you talking to them? Why are they listening to you? And I think that's one of the main things. You know, Dr. Murray, you said something, and it kind of sparked me. First, I'm not afraid of the vaccine. I'm not fearful, and I'm not scared. I ain't scared of nothing but my mama and my wife. But besides that, I think people
that's a good thing, sir.
Right. People just want to be educated. You know what I'm saying? We like when I went to get vaccinated, I would have preferred a medical person to be there just in case I had another question. Not some low level person just sticking a needle in my arm. So I think that's what it is. I can speak for the Black community, the people I deal with. We don't have any MDs or doctors that we love or trust to talk to us. We had a Dr. Roberson's, but we might want to ask this question, if I get this vaccination, is this going to mess with my diabetes? Is this going to mess with other pills that I'm taking? So it's not necessarily a fear, it's about more information. So as collectively as a group, how can we start addressing that? Is this something we should do, get more Black MDs to come out? Should we incorporate more young medical students to come and assist the people giving shots? Like what should we do? How can we help? How can we help our people feel more comfortable?
All of the above. In some,
yeah, all of it.
yeah, all of the above. In some parts of the country, well, nationally, there have been people that have the Black physicians, for example, that are doing this on Zoom and stuff. But in some parts of the country, Philadelphia, Atlanta, you have groupings of Black physicians and medical and nursing students too that are actively participating. And even then, this is not supported the way it should, because people are usually doing this on their own time after they finish their regular job. So I think it's really a misunderstanding of what Dr. Rubin was talking about. If you're going to put an emphasis on prevention, then you have to put resources in prevention. And the reason our country has done so badly compared to other rich countries is that we have not put the money in public health and prevention, and we do not have a workforce in public health that looks like the communities that they serve.
I'm sorry, I forgot. I got one last question, a very important question that somebody sent me. So in terms of the new variants that are coming out, is there going to be anything to address the fact that citizens can't sue for any malpractice with the pharmaceutical companies? Like if I grow a six finger or turn into a zombie, my old lady can't sue or anything. So how is that going to be addressed with all these new variants? And that's also creates a little skepticism for the American public. Like why would they put that clause in there and then they want us to take it? And how is that going to affect us with these new variants?
Yeah, I don't think that clause should have been there. I mean, frankly, you can sue for whatever you want to sue, but people are concerned that this vaccine, like you said, you're going to grow, a sixth toe on each foot or something. I don't know. I mean, how many people have not been touched by COVID? Either they've gotten it, family members, friends, communities, everybody at this point knows somebody that's died from COVID. And to say that the vaccine is going to be worse than getting COVID is just crazy, And how many vaccines do people usually get in their lifetime? I mean, most of them are when you're a kid, but not all of them when you're a kid. Hopefully you get your flu shot, though not everybody, Mr. Murray, gets a flu shot. Tetanus, right? Tetanus shot, very important. You get that. Pneumonia shot. There are adult vaccinations that we get periodically. There are vaccines to prevent hepatitis A and hepatitis B, and these are standard adult vaccinations, not just the kids' vaccinations. How many people after getting these vaccinations have problems? Almost none. I won't say that there have been no complications, but there haven't been long-term complications. Sometimes somebody is allergic or they have an unusual reaction to the vaccine. But generally speaking, 99.99% of the time, the vaccine are fine. After a tetanus shot, my arm feels sore. After a flu shot, my arm feels sore, and it goes away. So to say that people are worried about the potential complications of the vaccine, what about the potential complications, including losing your life from getting COVID?
So let me ask a hardcore question, Dr. Rubin. Is it okay for my mother who got the vaccination to get a booster shot and an annual flu shot with that type of cocktail in her body?
Yes, I think that she should. And I know your mother a little bit, and I know what's going on. I definitely think that she should get all those vaccines because she's in a situation that if she gets COVID, she can get really sick. She can get really sick from it. So she should get a booster, and she can get it anytime she wants now because the boosters are available for somebody in that situation. And then also a flu shot. And they've also shown now that you can get 2 vaccines at once. It's okay to combine, not that you have to, but it's okay to get your flu shot at the same time that you get your COVID booster.
So let me ask you all this too. It's a 2-part question. There's 2 types of COVID testing now. Can you all explain that to people? There's one with the antigens, and then there's one that's not. So what test should people be getting? And then the second one, it's not really a question, it's more of a comment. a lot of people don't even know where to get tested or the vaccination. And I've been hearing a lot about that. So can you all just explain first the type of test that you should get and the difference between the two?
There are the last time I looked, there were several hundred COVID tests running around this country. But let me speak in broad categories. You have what we call the antigen test, which is not nearly as accurate or reliable. And we have the PCR test. That's the one where they put it up your nose, or University of Illinois has developed a PCR test from your saliva, where you sort of spit in a tube, which I personally prefer much more than the putting up your nose. Now, the University of Illinois test is not widely available at this point. It is FDA approved, but it was taking place in Urbana and UIC here in Chicago. Hopefully, it'll get more widespread. People can look.
In fact, just to interrupt, in fact, the spit test, so to speak, is now going to be available for all schools in the state of Illinois, provided by the state.
That's right. That's a good thing. So people can always go on the web. These sites change. People can always go on the web to find out where to get tested. I would encourage you not to have to pay for tests. A lot of places are charging a lot of money for tests, and it may be one of these antigen tests. So if you get a test, get a PCR test. The vaccine is still free, which means you could go to a Walgreens or a CVS, try your doctor. If you have a regular doctor, you can try your doctor. And of course, the county and the city still have sites. And they also, both of those places have door-to-door. If you have someone who has real trouble getting out of the house, is bedridden, there are phone numbers you can call in the city and in Cook County, and someone will come to the home and do the vaccination.
Do you know those websites and numbers offhand?
The one for the county is covid.cookcountyil.gov. So that's covid.cookcountyil.gov. In the city, if you just go to the Chicago Department of Public Health website, it's there. And I forgot the actual site, but it's right there. And then also about the testing, is that people, are worried, where can I get testing? There's actually free testing in most retail pharmacies. Certainly the Walgreens and most of the CVSs have free PCR testing.
And I'm working with an African-American owned group called Agile Technologies. And I'm trying to look for their information right now. And they're part of the whole pop-up that I have, PPE pop-up. And they go around with us to every location in the far south and south suburban communities. And they have both tests.
Let me throw this out here. Thanks for the information from both of you, from all of you all, actually. I have daughters. Will this vaccination and the booster shot affect their reproductive systems? Because I've read articles where it affected every lab rat and mouse, the mice that they tested it on. So what's the deal with that with women when it's concerns around vaccination and reproduction?
Right now, we don't have long-term. You're talking about long-term effects. What we do know right now.
You know what? Let me change my question. I mean, you all are only 30, so let's say, and all you all have children. If you all were 20 years old and this came out, would you get vaccinated before you had your children? Doc, Murray, it wouldn't have affected me, though. I'm just saying, but good. Would you? Would you all have gotten it? Or would you have thought twice about it?
I would have thought twice or three times, but yes, I would have gotten it. So again, it's a question of risk. The point I was going to make is that we know either deliberately or by accident, we've given this vaccine to thousands of women who were pregnant. Maybe they were pregnant and didn't know they were pregnant yet. There's been no evidence at this point that women that got the vaccine while they were pregnant, that there've been any bad outcomes from that. We don't know. I'm going to be honest with you. If someone asked me, well, how do you know what a bad thing might happen in 5 years? We don't know because we haven't had the vaccine that long. But right now we have no indication. And more importantly, we have lots of vaccines similar to these, and we're not expecting any of that kind of problem. We should look for it. I'm not saying that we know 100%, but there's no evidence of it right now, and we're not really expecting to see anything around that.
I mean, that's what we need to hear. That's what the general public wants to hear, that pregnant women have successfully had babies and they were vaccinated. Another quick question. Should children
Well,
under
one
12
thing,
be vaccinated?
something else we know, Marcus, I hate to interrupt you. We know that unvaccinated pregnant women that get COVID have major problems. And the COVID is worse in them and there are more complications. So that we also know.
Does it affect the child?
I don't know that specific data, but I know that the pregnant women, have had adverse consequences. I haven't read anything carefully on the children.
And just a quick question about children again. So let's just say children under 10 or children at daycare, if it was possible to have vaccinations at the schools, should we let our children get vaccinated? Daycare age, we'll just say K through 8th grade.
Absolutely. And not only in daycare, I think we will see in the next 6 or 8 months, the clinical trials are going on now. I think we'll see children above 6 be cleared to get vaccinated. And then I hope in the next year we'll see children from 6 months up get vaccinated. Remember, you don't know what your child has when they go to daycare or kindergarten. And you don't want to be in a position where you're infecting children that are immunocompromised, etc. So we will see children being cleared for vaccination soon. And when it happens, people should definitely. I would be really glad if my child were that young. I would be thrilled if the vaccine got cleared. And many parents I know, especially parents whose children have asthma or some other health problem, they have been really glad when that child reaches the age of 12 and can get vaccinated.
Is there any possibility of the county or city governments having those type of vaccination programs at like CPS schools or maybe some daycares? Is it even in the talks as potential opportunity?
We're doing vaccination programs with schools, but it's not like providing a supply to the school nurse who can give it to any child that has the permission to do so. But we're working with back to school events that are happening and pairing them up with vaccination programs. And eventually, I hope that it just becomes part of a routine vaccination in whatever provider that you see. And then also we have to have always, vaccination campaigns to get people that don't have a good relationship with their own physician and to focus on schools for sure.
So, Dr. Roberson, what can we do as a people, as health professionals, as government employees? What can we do to help your fight to saving our hood?
I have really seen in the midst of this pandemic, a lot of people really coming together, community members, leaders, and organizations. And I feel like if I had a whole healthcare team, like if Dr. Murray, Dr. Rubin, if any of you or your colleagues will want to come out and work with us in the community, I need like endocrinologists, just like you said, Marcus. You might have felt a little more comfortable if you had a doctor on site with you, or even having community health workers or someone to just be out there. I think they should be utilized even more too, to help even pass out resources, things that the doctors don't have time to do it in a normal doctor's visit. But I even have a group of chaplains that come out, and I call it Ask a Chaplain, where they just do like resilience building and just, encouragement and empowerment for people in the community that are still struggling or a little afraid, but to just have more people, professionals, experts out in the community there to answer questions that people might be afraid to ask at the regular doctor's visit. Because that education is key.
Excellent. So as we get ready to wrap up the show, we're running out of time. I wish we weren't running out of time. We usually go around and let you all say something, talk about anything you want, or you can stay on the topic. So we'll start with you, Dr. Rubin.
Thank you very much for having me this evening. It's been fun. And I hope that we've gotten some messages across that, we're also here to answer those questions. And I so take to heart what Dr. Roberson just said, is that one thing that we're trying to do is to have doctors on site when we do vaccinations, because we want people to be able to have their questions answered on site with somebody that hopefully they trust, but to also obviously have healthcare providers and community health workers from those communities. So to try to get folks that are those community health workers to work with us when we go out to these communities, I think is a fantastic thing to work on.
Dr. Roberson?
Remind everyone in the beginning, Dr. Ezekiel said before this is all over, everyone is going to either be affected or infected, and we've seen this and it's here now. And I just would like everyone to stay safe. Read for yourself to learn so you can make informed decisions and get vaccinated.
Dr. Murray? And is it safe to travel, Dr. Murray? I forgot to ask you earlier.
It depends. All of these things depend on your personal situation, where you're traveling and how you're traveling. You have to really pay attention. If you're immunocompromised with Delta going around, you have to be really careful. And again, I hope that people have someone that they can talk to with some clinical training to help them figure that out. I want to just say to...
Hold on, doctor. I'm sorry. Let me be more specific. Should you travel to the Bears game in Los Angeles and Vegas as a Chicago Bears fan on a plane? Is that safe?
Well, people that are vaccinated and have an appropriate mask to wear, either an N95 or a KN95, if you like the Bears, it may be a risk worth taking. Now, if you think the Bears are going to lose, you may want to stay home. But let me just say this: we are challenged by many, many things. Police shooting us, schools not educating us, health inequities. We don't need to be dying from coronavirus. And so what this means is that our community has to come together in your fraternities, your block clubs, your churches, your synagogues, whatever, the mosques, and really struggle with this, ask each other questions, find out information, educate each other. Because if we don't do that, we'll just sort of die one by one in our homes. And I hope we have a community fight back and really try to make the government do what they're supposed to do for our communities, but also make sure that our people have the information that they need. And again, I want to thank everybody for joining us this month. So I'm going to turn it back to you, Mr. Murray.
I want to thank everybody as well. We'll be back on the third Wednesday of the month next month. And I know I throw out a lot of skeptical talk around vaccinations and everything, but again, I'm not telling people to go get it. I want to provide you with education and let you make the right choice. I got vaccinated. I don't regret it, but I was on the fence, but I'm not going to do a booster. And again, I want to thank everybody, especially my man, the super producer, Dr. Dre, because without him, we couldn't even have this show. So again, next Wednesday, the third Wednesday of the month, thank you all for coming on. And we'll see you. Thanks, Dre.